Hey guys, it's me, Dr. Reen. In this video, we're going to be looking at the muscles of the axial skeleton. Now, in the lab, we're going to go through way more muscles, but today we're just going to kind of point out some of the main ones that you need to be aware of for lab and for lecture. So starting at the very top, we're going to talk about the muscles of the head. The head muscles are separated into two different categories, the muscles of facial expression and the muscles of mastication. So this is a list of a whole bunch of muscles of facial expression. I want to point out a few that are really important to know. So occipitofrontalis, also known as epicranius, is found right here kind of in the forehead. That's the muscle that raises up our eyebrows when we're kind of questioning something, right? That's the occipitofrontalis. If we go right below that, surrounding the eye, we have orbicularis oculi. Orbicularis oculi is the muscle that helps close the eyelid. So that's this one that kind of encircles around the eyeball. If we go medial to that, right on the nose, we have the nasalis. So this, the nasalis muscle is kind of what scrunches your nose together. Like if you're trying to make a bunny nose, or if you were kind of like something smelled bad and you kind of scrunched your nose, that would be what nasalis is doing. We also have, if we come down a little bit and we look in this general area, we have buccinator. So buccinator is kind of right down here. It's a little hard to see in my drawing here, but buccinator is what resists the puffing of the cheeks. So if any of you play, say, trumpet or anything like that, a really famous trumpet player, he actually had a disorder where his buccinator was not innervated properly, and so it didn't resist the puffing of the cheeks. So when he blew, his cheeks would get really, really big. But what resists kind of having that structure of the cheeks where when you puff your cheeks, you feel that resistance, that force is created by the buccinator muscle. Another important one is the mentalis, which, remember, mental means chin, so the mentalis is on the chin. Mentalis is what gives that pouting face. So when you kind of draw that lower lip down and you pout a little, the mentalis is doing the work there. We also have orbicularis oris. Oris, kind of like oral, O-R, is going to be surrounding the mouth. Orbicularis oris is what, also known as like the kissing muscle. It's what allows you to pucker up. There's again a bunch of other muscles, but this group of zygomaticus major and minor, which you can see are right here, they actually pull up the sides of the mouth and they help with smiling. So if you look here in my little diagram, now these are some drawings that I did back in some other anatomy classes. So some of these names aren't ones that you're going to be necessarily responsible for, but they're here if you ever want to know further or know more about stuff. So with our smiling muscles, right, we have that zygomaticus and smiling, as well as orbicularis oculi, right? Because when we smile, think about it, your eyes start to close a little bit. So that's where we get the orbicularis oculi. With frowning, we have things like the platysma, orbicularis oris, the mouth, right? It's going to help close the mouth or pucker the mouth kind of going down. Mentalis, right? That lower lip is going to go down when we frown, things like that. So those are the main ideas or the main muscles of facial expression that you kind of need to focus on. And again, we'll look at these more in depth on models and on diagrams in lab. Then we have the muscles of mastication. Now there are 4 muscles of mastication. Here you can see 2 are highlighted. So we have temporalis. Oh, it's freezing for a second. Please wait as there we go. Temporalis. And we have masseter. So the temporalis is right on your temples, right above your ears, that area. It's a really tender area, and people that have headaches and things like that, anxiety, stuff like that, we get really tense in our temporalis region. Masseter is on the sides of the cheek, kind of right where the jaw attaches. And then we have 2 others. So the muscles of mastication, there are 4 of them. We have temporalis, we have masseter, I never spell it right, E-R, and then we have the pterygoids. So we have the lateral pterygoid, and in class I'll show you where that is, just in this diagram, you can't see it. And we have our medial pterygoid. So those are our 4 muscles of mastication. We'll get more into this in lab. Now let's look at the neck region. Now there are a whole bunch of muscles that are related to the larynx, pharynx, neck, anterior, posterior, a bunch of them. Again, lab will get more in depth. But some of the things I want to mention right here is that we have our sternocleidomastoid muscle. It is named based on its insertion and origin points. So it attaches to the sternum, and it also attaches to the mastoid process, which is right below the ear. Okay, so sternocleido meaning clavicle. So that's its other, it has 2 heads. The sternocleidomastoid muscle has 2 heads, one attaching to the sternum, one attaching to the clavicle, and it originates at the mastoid. So that is this muscle right here. And that is the muscle, if you turn your neck and you kind of feel that bulging at the side of your neck, that's typically the SCM. SCM is the abbreviation you'll see a lot of times for the sternocleidomastoid. We also have underneath here, you can kind of see these muscles underneath here. Those are our scalene muscles. And those are common muscles that get really tense and can cause a lot of tension headaches and things like that clinically. But that's kind of some of those muscles we're going to be talking about. We'll also be talking about digastric muscles and some specific muscles of the pharynx, but we'll kind of keep that for lab. But sternocleidomastoid is one of those really big muscles of the neck that does a whole lot of rotation and movement and is used a lot when we look down at our devices. It can get really tense, and it's common one that you will find is tight in students as yourself. We also have separating kind of that neck region, suprahyoid and infrahyoid muscles. So let's just talk a little bit about what the suprahyoid muscles are and infrahyoid muscles are. So based on its name, supra is above, these are the muscles above the hyoid bone, and infrahyoid means that they are the muscles that are below the hyoid, and they act to help with different types of movement that we have happening within our interior neck. So there are 4 muscles that you need to know for suprahyoid. They are mylohyoid, stylohyoid, and they're named, again, kind of where they are attaching to. So the mylohyoid and stylohyoid are going to be attached to the hyoid. Stylo going from the styloid process to the hyoid. We have our digastric muscle and our I don't know how to say it, but this one, hyoid, okay? So as you see, they all have hyoid except for digastric. My little way of remembering it. So, my sexy dang gonads are super. Okay, so super reminds me that I'm talking about supra. So see how the letters gonads, and I do this because it reminds me that it is genio, kind of sounds like gyno, so that makes me kind of think that way. So that's how I remember it. If you have another way of remembering it, there you go. But that's my little way of remembering those 4. Then we have our infrahyoid muscles. We have 4 of these that we need to know. So these ones are below the hyoid bone, but because they're below it, a lot of them are attaching to that hyoid. So we have thyrohyoid, we have omohyoid, we have sterno, meaning sternum hyoid, and we have sternum thyroid, attaching from the sternum to the thyroid. So those are our 4 muscles. So I remember how to remember it is toss in. So in goes with infra, toss is the T goes with thyrohyoid, O is omohyoid, S is sternohyoid, other S is sternothyroid. So those are our suprahyoid and our infrahyoid muscles. So that's some of the anterior neck things. Let's talk a little bit about our posterior neck. Oh, there we go. So in our posterior neck, there's a whole lot of muscles, but an important area of the posterior neck is the suboccipital triangle. This is going to be a small series of muscles that are at that C1, C2, the atlas and the axis, as well as the occiput. Remember that the occiput is that occipital bone that we have in the back of our skull. So you kind of see my drawing here, and I just want to draw for you where we find these muscles of the suboccipital triangle. So if we were to draw, let's do the first one. So you can kind of see I have an origin insertion. So our obliques are going to go in an angle, right? If you see an oblique, they're more of an angular thing. So they're going to go from the TP, right? TP, remember, that is going to be our transverse process. It's going to go from our TP up to our C1 TP. So it's kind of doing this little tiny line going from here to here. Oh, sorry. So we have one coming here to here. So there's one muscle. We have coming from here to down here. Another muscle. Let me just draw them in first so then we can see. We have from here to here a muscle. And then we have, let's do it in blue, here to here. And so the suboccipital triangle is actually these muscles right there. This yellow one, that is rectus, capitis, posterior minor. So it's technically not part of the actual suboccipital triangle, but we still count it. We still give it a little. This one right here, that green one, is going to be our RCPM, our major. And then we have our two obliques. So we have our superior oblique, so I'm going to call it OCP. And we have our inferior one, OCI. So that's how you kind of draw those muscles. Now that is super duper down low, okay? So that is like as far down as I can. But above these muscles, we have some more important muscles that move our neck around. We have our sternocleidomastoid that we talked about that we have in our front region. It does come back into that mastoid process. So the sternocleidomastoid is actually starting here, and then it's wrapping around to that front. So you see how it kind of starts here and it wraps around to the front. Okay, so that's where it's starting on the mastoid process that we see in this picture right there. So that's where we see the sternocleidomastoid. It's going to kind of wrap around in the front, okay? Then we have coming kind of on the other side of that, and let me do it in a new color. So in this purple, we see kind of lining on top of that, on top of everything, we have our trap. So our trap is going to kind of come here. We're going to talk more about our trap muscles in the future. But for now, that's kind of what we see there, okay? So that's our purple trap. But let's take away the trap for a second. We're going to talk more about that because that works a little bit more with our shoulder blades. Let's go deeper to that. Deeper to that, we have our semispinalis and our splenius. So our splenius, we'll do it in this dark yellow. So splenius is going to come, it sort of comes right where we saw here, but it comes down like this, right on the inside. So that is our semispinalis. And then coming kind of obliquely on top of these, like in this direction. So if I were to draw muscle fibers, so let me do it in a different color so you can see muscle fibers. The muscle fibers would be going kind of this direction. So going in that direction, that would be splenius. Whereas semispinalis fibers, if I were to do a color to show the fibers, it would go this direction. Now I see that's a whole lot of colors, so you can go back and not see them. But that's kind of what we're looking at when we're looking at the neck. Okay, again, we're gonna go through all of this more in lab. Let's continue down the neck and talk about the muscles that are the deep muscles of our back. So these are our erector spinae muscles, are the main stabilizing muscles of the back musculature. So there are 3 parts of the erector spinae, or 3 muscles, but those muscles are then broken up into different regions based on if it's in the cervical spine, right? Cervical spine is here, thoracic spine is here, lumbar spine is here, right? So that was stuff that we talked about in previous labs when we did skeletal. So the erector spinae, we have the spinalis groups, we have our longissimus groups, and we have our iliocostalis groups. Those are our big main groups. So let's kind of look at them a little bit. So starting with spinalis. So our spinalis, I'll do in pink here. So spinalis cervicis is going to kind of be right here. So that is spinalis cervicis muscle. Then we have, so that's going to be the cervical spine. Then we have going in the thoracic spine, so starting kind of in the thoracic spine area and coming down, it's going to be, so it gets its name spinalis because it's attaching to the spinous. Okay, so that would be spinalis thoracis. Okay, so that's kind of what we're seeing there. Now, if we were to go on the outside of those spinalis, we would have our next group. So spinalis is the most medial group. Then we get into our longissimus. So our longissimus, let me do in this green color. So longissimus is going to kind of start up here in mastoid territory. Is going to kind of attach like that on the side. So it's attaching a little bit on the side. So that one that I just drew would be longissimus capitis because it's starting at the cap. And then it intertwines itself with longissimus cervicis, which is going to kind of go in here. So longissimus capitis, which is going to intertwine then with longissimus. And again, this is just based on what part of the spine is it attaching to. Cervicis is the cervical part. And then from there, so we kind of have those two. Then from there we have our longissimus thoracis. So they're kind of like right in here. Kind of attach them here. And they come all the way down here. So then we have the longissimus thoracis and our longissimus lumborum. Okay, so that's kind of what we're seeing there. So you're kind of naming them based on their region. So the lumborum ones would be there. Okay, and then our final one, the most outward one, is our iliocostalis. So costalis, meaning that it's attaching to the ribs as well. So it's attaching to the ilium or the iliac area, and it's attaching to the costal. So that's kind of where you can kind of think of the name. So if we start up here, our iliocostalis, the first one we see is iliocostalis cervicis, which kind of attaches. I see that this color is not maybe the best at this beginning, but there's iliocostalis cervicis, okay, right on the neck. Then outside of that, now imagine the scapula is not here because this would be all in the rib cage, not on the scapula in this picture. So then coming off of that, we have iliocostalis thoracis. So you kind of see it like that. And then that would turn into iliocostalis lumborum, which attaches down there. Okay, so what you need to remember, spinalis is closest to the midline, then it goes longicimus, then it goes iliocostalis. Knowing those three is going to be kind of the start of the muscles that you need to know for the back. Now looking at the thorax, so we're looking more like the anterior aspect of the thorax, there are some important muscles to know. The external intercostals and internal intercostals are going to be essential for how our ribs are moving while we're breathing. So external intercostal are going to elevate the ribs, and internal intercostal are going to depress the ribs. So when you breathe in, feel that elevation of the ribs, and when you breathe out, feel the depression of the ribs. So external, E goes with elevate, internal goes with depress. Here's what's tricky. People think internal and they think that's when we inspire, but it's not. Okay, so it's the opposite of what you think with inspiration and expiration. So just remember that external goes with elevate, and when you breathe in, our ribs come up, right? Okay, so that's just kind of something I want you to think about when we're thinking about the external and internal intercostal. And we'll talk a little bit more about lab on what the direction of those are. Now let's look at the anterior abdominal wall. So in the anterior abdominal wall, clearly we have a whole lot of muscles, right? There's a lot going on here. This big sheath, the six-pack abs that you're thinking about, that is called the rectus abdominis. So we see that right here. The rectus abdominis goes from the pubic crest of the pubic symphysis to, and kind of goes all the way down in that way. It depresses the ribs and it flexes the trunk. So when I do a crunch, I'm thinking about rectus abdominis. We then have our external obliques and our internal obliques. And so in this picture, we can kind of see those two different types of obliques working with our external and our internal. And then surrounding on the bottom of those, so you kind of see external going this way, internal are kind of going the opposite way. And then our transverse abdominis is going this direction. So our fibers themselves, external oblique are kind of going this way. Internal oblique are kind of going that way. Transverse abdominis is kind of going this way. And then rectus abdominis are kind of going that way. And so that's why our trunk is able to do all of those different motions that we do when we think of abdominal exercises, right? Because we have different muscle fiber directions for all the different muscles of the anterior abdominal wall. Now there's a whole lot of information on this page that is stuff you don't need to know. These are just some of my old drawings from previous gross anatomy classes that I taught. Okay. Those are the main muscles that we're going to be covering in lab. I know there are a lot. You guys got this. Just kind of practice, focus on the ones that I highlight, and you guys will definitely succeed. I will see you in lab.